Hello, we're going to talk about rhomboids major and minor and the three primary actions. These muscles do have some additional actions at the spine and some subtle actions at the acromioclavicular joint, but we'll save those for another video. So rhomboids major and minor typically work together. As a group, they have medial attachments on the spinous processes of C7 to T5 and lateral attachments along the medial border of the scapula. The primary actions are retraction of the sternoclavicular joint, downward rotation of the acromioclavicular joint, and depression of the SC joint. More specifically, we have rhomboid minor. It has a medial attachment on the spinous processes of C7 to T1 and a lateral attachment on the medial border of the scapula at the root of the spine of the scapula. And the actions include retraction of the sternoclavicular joint and downward rotation of the acromioclavicular joint, and the innervation is the dorsal scapular nerve, which comes from C4 to C5. And rhomboid major has medial attachments on the spinous processes of T2 to T5 and a lateral attachment on the medial border between the root of the spine of the scapula and the inferior angle of the scapula. The actions are retraction of the SC joint, downward rotation of the AC joint, and depression of the SC joint. So the depression of the SC joint is unique to rhomboid major and is not an action of rhomboid minor. And its innervation is also the dorsal scapular nerve of C4 to C5. We are now looking at rhomboid minor and major in the transverse plane, looking at a longitudinal or vertical axis of the sternoclavicular joint. Both muscles will contribute to retraction of the clavicle at the SC joint. The line of pull on the scapula is medial, which would pull the scapula towards the spine. That in turn would create a posterior torque on the clavicle at the SC joint. We are looking at the right side from a superior point of view, and we'll see that line of torque would actually create a clockwise rotation, which is in fact retraction of the clavicle at the SC joint. Just keep in mind that that motion of the scapula towards the spine is simply a consequence of the rotation at the SC joint. Here we have rhomboid minor and major looking at the frontal plane along an anterior-posterior axis at the acromioclavicular joint. They will work together to create downward rotation of the scapula at the acromioclavicular joint. So we're looking at the right side again. The line of pull of the rhomboids is going to be superior and medial on the scapula. That will rotate the glenoid fossa downward, or from this point of view, it will be a clockwise rotation at the AC joint, and that does result in downward rotation of the scapula at the acromioclavicular joint. Next, we're looking at the action of rhomboid major in the frontal plane at the sternoclavicular joint along an anterior-posterior axis, and this action will be depression of the clavicle at the SC joint. The line of force is pulling medially on the scapula, which is in turn attached to the clavicle. We have a posterior view of the right side. That line of pull will actually create a clockwise rotation of the clavicle at the SC joint, which is depression of the clavicle at the SC joint. We can view the clavicle and the scapula as a single unit, and we see as that clavicle is depressing, or in this case rotating clockwise, it will bring the scapula towards the spine, shortening the fibers of rhomboid major. And if we look at rhomboid minor, you can see that the fibers are pretty much right through that anterior-posterior axis, which means they will in fact have very little action at that joint in this plane.